My name is Dr. Cynthia Collenberg, and I'm a hip and knee replacement surgeon at the Hospital for Special Surgery. My special area of expertise is specifically in hip and knee replacement. I do both anterior and posterior hip replacement, and I also do partial and total knee replacement surgery, as well as complex revision hip and knee replacement surgery. The most common conditions that I treat are hip or knee arthritis, most commonly osteoarthritis, but also sometimes rheumatoid arthritis or post-traumatic arthritis, meaning arthritis that's developed after an injury. So I see patients who come in for either hip or knee pain, and for many of those patients, they're coming in because they've tried other conservative management and it really hasn't worked to get rid of their hip or knee pain, so they're coming in for consideration for joint replacement surgery. I see patients predominantly at the Stamford, Connecticut location, and I also see patients here at the main campus in New York City. I love being able to bring the HSS quality of care to the Connecticut area, and I think it's a lot easier for patients in that area to obtain their care locally rather than having to come down into the city, but still be assured that the quality of care that we bring is the HSS level of care. My goal as a physician is really to help patients get back to what they love to do. So most patients who come to see me are coming in because they're limited in their activities or limited in their mobility, which can really make things very difficult for them. So my goal in treating each individual patient is to get them back to the activities that they love, whether that be golfing or skiing, whether that be taking a walk with their family or playing with their grandchildren. The most important thing to me is to get patients back to the activities that bring them joy.